to Swami, thanking him for the opportunity to serve and for him to guide us through the next week of our work. So let's do the Gayatri 3 times and then we disperse and see you back in the plane. Om Vasvaha Tatsaviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yonah Prachodayat. Om Vasvaha Tatsaviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yonah Prachodayat. Tatsaviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yonah Prachodayat. Shanti, Shanti. Thank you, Swami. Some of you have worked very hard. You need a cup of coffee. Thank you. See you inside.
I am born now from the womb of sleep. I am determined to carry out all tasks this day as offerings to Thee. With Thee ever present before my mind's eye, make my words, thoughts, and deeds sacred and pure. Let me not inflict pain on anyone. Let no one inflict pain on me. Direct me, guide me this day. Thought of the day. Love your religion. Love your religion so that you may practice it with greater faith. And when each one practices his religion with faith, there can be no hatred in the world. All religions are built on the universal love. Love your country so that it may become strong, happy and prosperous, an arena for the exercise of all the high faculties of man. Prayer must emanate from the heart, where God resides, and not from the head, where doctrines and doubts clash.
We'll sing the theme songs. We are one in the Spirit, we are one in the Lord. We are one in the Spirit, we are one in the Lord. Jesus, we are one in the Lord. We are one in Jesus, we are one in the Lord. And we pray that our unity may this day be restored. And we know we are brothers by our love. By our love, yes, we know that we are sisters by our love. We are one in Allah, we are one We are one in Allah, we are one in love. And we pray that our unity may this day be restored. Yes, we know we are brothers by our love, by our love. Yes, we know that we are sisters by our love. We are one in Buddha, we are one in Allah. We are one in Buddha, we are one in Allah. And we pray that our unity may this day be restored. We know we are brothers by our love, by our love. Yes, we know that we are sisters by our love. We are one in the Lord. We are one in the Lord. We are sisters by our love. Thank you. Now everybody can go to their own stations and start getting things ready. Thank you.
Good morning, Dr. Fred Merchant. Welcome. Thank you for agreeing to do this interview with us. My name is Vani, and I'd just like to ask you a few basic questions about the medical camp that we're having here at the moment. If you don't mind, I'll ask you to first maybe give a little bit of an introduction about yourself and your history here in Fiji.
Thank you. Nice to be here with the Psi Medical Camp, and thank you for this interview. I'm very appreciative of this opportunity to experience the camp. As you said, my name, and I'm a surgeon, partially retired. My training is in surgical oncology and trauma. I'm an American expatriate. I'm a Fiji citizen, and I've been here more than 10 years, working at the University of Fiji School of Medicine. I teach anatomy to first-year students. I teach pathology to second-year students, forensic medicine to third-year students, and I also teach some terminology. I've been associated with the Suva Private Hospital as a head surgeon in the past. I also taught at the Fiji School of Medicine and Surgery, and I've been involved continuously with the Fiji Cancer Society. So I like being in Fiji, and I enjoy teaching and treating patients and doing the best I can to improve the health of my community.
Wonderful. Thank you. I just wanted to ask you, what are your thoughts on these type of medical camps? And also, in your opinion, how do you feel that it sort of, whether these camps are of any assistance to the local community, and how do you think it actually would assist the community?
My thoughts are all positive about the Psi camps. As you may or may not know, there are many communities that are far away from the medical centers and the urban population, so sometimes their medical care is not as ideal as we would like. Also, we like to educate the population, and I think the Psi medical camps fill a very important niche, if you will, a place where they can deliver care to patients and their families and communities on a one sort of stop-shop basis when the camps take place. People talk a lot, they spread the word, they communicate with one another. They always find the camps to be useful, productive, and the staff to be, most helpful in terms of their health care. I have all positive things to say about the camp, and I admire the effort made by all of those who participate, who make the journey to Fiji and bring their expertise along with supplies and other matters to help benefit people.
Wonderful, thank you. As a participant of the camp, I've noticed really strongly noticed the presence of the students during the camp. They've been extremely helpful to us as volunteers, but how would you say the students benefit from this type of opportunity?
A great question. Part of the teaching of medicine involves going from a non-doctor to eventually becoming a doctor, which means taking theoretical information and knowledge and then understanding how to apply it to the practical situation wherever the patient may be. Our goal is to have qualified physicians who can do that, and this contact with patients on a practical level is most important. The transition from being a classroom student, which they've been accustomed to being a student who's actually working in their chosen area is a very major step, having to deal with, especially young doctors, dealing with older patients in a variety of sometimes unpredictable circumstances. All of our students are benefited by it across the board. they have never said anything or have negative thoughts about their experiences with the community or with the camps because they're mentored by professionals who have a vast amount of experience. They are mentored by people who are clearly deeply enthusiastic and committed to what they're doing, which is so important when developing the young medical mind, the commitment, the desire to do your very, very best and to see a project or a patient through their difficult times. And this is a daunting task for a young person, and I think the Psi camps help to cross this bridge in a very comfortable, productive manner, and to be surrounded by professionals who really give more than what one could write about. They give the intangibles, they give experience, and they give their heart and all of their energy to this project. And I think our students sense that, and they take away a great deal that they don't get from a normal, just hospital experience. And besides, they're seeing people who are members of their own community.
Thank you. Moving on to the next question. As a representative from UPSM, what are your expectations of this camp?
Well, for one, we all discuss this when we return. We do a debriefing, if you will. A part of the debriefing involves commitment to writing their experiences, describing some of the details, some of the nuances of their activities and interactions with patients. It doesn't necessarily have to be a patient. It could be with another colleague or something they've made, hopefully, an observation of. They have to document this, and it's kept in their record, and it's graded. They have rules to follow with respect to composition, presentation of ideas, the use of audio, the use of visuals, that is diagrams, photographs, etc. All of these are a part of a blended presentation that gives us and lets us see a snapshot of their experiences during the camps. Oftentimes they are very moved and even select specialties they might go into based on their experiences in the camp. They're driven and drawn to certain circumstances. And sometimes this could never really happen in a classroom setting or just a hospital setting. Also, many of them are deeply moved by working with these committed professionals and seeing that they are giving of themselves and there's no anticipated or expectation of a material return. They're not paid. And I think this is very important because sometimes students come in with a lot of ideas about remuneration and who's going to be ahead of whom, the competition. But when you're treating your patient, you're really competing against yourself to do what you think and what you can demean as the best treatment to obtain the best outcome for the patient. So these are some of the things. We do a lot of discussing. We discuss a lot about what they experience. And we are developing an assessment form which will then give some numerical value to what they have experienced. And this is a bit complex, but we're working on that as well.
Okay, thank you.
You're very welcome.
Just moving on to another aspect of the camp is, I guess as a person who's sort of an observer or, well, I guess actively participating as well, but do you have any suggestions or any thoughts on how we could further improve these camps to make them more beneficial for, I guess, everyone involved?
Well, the first thing is let's have more of them. Let's have them every day, which is not practical or possible. But I think considering how much is involved with the logistics of moving and coming from another country, I think this is an outstanding effort. And if it were possible to increase the number, that would be perhaps, instead of doing 4 or 5 days, do 2 weeks. That would be helpful, but we don't want to exhaust, the giver. I think when we do gather people who are waiting, especially this hot, and we have weather problems, sometimes additional audio visuals in the waiting areas we've had before help to distract and give information at the same time and keep them less restive if it's possible. giving medical information. Most people like to have something in their hand they can carry away. So if we can give information that we think is going to be useful in the vernacular, the languages that people speak, or with additional photographs, etc., that helps. I've also found that when we have what I would call ombuds people who can go around and simply talk to people and say, how are you feeling? If there's something we can get for you, maybe a little bit of water or something, they find this to be useful. But to do as much as we can to not overwhelm people with medical information, but to give them what they can absorb and that might be useful. Sometimes we ask people when they're sitting and they come up with things they hadn't thought about in terms of their health or some relative or a friend. So we might do a little bit more of that, but I don't feel that we can change the basic structure and bring in other equipment. I don't think that's really going to change. I think you bring in an enormous amount of equipment. Patients leave with glasses, sunglasses, they know about sun, they leave with medications, they leave with advice, and then they have to take it upon themselves to assume some of the responsibility for what may happen. We also might better establish contacts for referrals when we have to refer patients, and so have a list of doctors or medical resources in the area, so we can point and say, based on what we know, you can go right to this person and continue the treatment or diagnosis after we leave. So there's some kind of continuity. And I think, I know the organization does the best it can to try and include a kind of background of interest from the local medical community, although everybody's very busy, but to let them know we're here. We may be sending you patients. We appreciate if you do some follow-up and maintain some kind of support contact with other doctors, because doctors like to talk to one another. Medical professionals like to do that, and then we have more perhaps of an opportunity for some follow-up.
Well, that sort of brings me to the end of any sort of formal questions I have, but thank you for your time this morning, and did you have any other thoughts you'd like to share with us about the medical camp and this experience in general?
Well, it's all positive. As I said, I consider the Psi camps with this new medical school, Mount Prasad School of Medicine, UPSM, who have become an integral part of the curriculum. The students look forward to it. The staff looks forward to it. We're all enthusiastic about the days and the times these are going to take place. And I think all of the students in particular feel that it's a part of their growth and development as young physicians to have an opportunity to participate in this. It's a bit of a grail that they look forward to. And the young students come in, begin talking immediately about when are the camps going to take place, will we be able to go this year, how does it work, and they hear the stories, because medicine, after all, is about stories. We start by getting the patient's story, the patient's history. We start by trying to associate their thoughts and how they express their feelings about their complaint or illness, and that's a story. And so doctors among themselves are always telling stories, and when our students exchange stories among themselves, they include uppermost the Psi medical camps, and they've been talked about, and I think as far as UPSM is in existence, it will always be associated with the Psi medical camps, and students will look at this far into the future and say, what a great experience I had, and hopefully other students will be able to enjoy it as well.
Wonderful. Thank you once again for your time and sharing your thoughts with us today.
Thank you.
Yeah.
Thank you for having me, and it's great being here.
Thank you.
Okay.
Thank you. Hi, good evening. Gunu has asked me to do the honors this evening. It is traditional for us to thank the team that has hosted, facilitated, and helped us to run 2 days of such successful medical camp. When Gunu, Lawrence and I came here in October, the first school that we went to was this one, and we were received with great enthusiasm, and we were encouraged to come. And we were not mistaken in making the choice, and we are very grateful to you, Lucia, and Ms. Khan, for the great cooperation, the facilities you have provided, and the kindness with which you have treated us. So we are very, very grateful. We pray that the school functions extremely well and produces excellent citizens for this country. Thank you very much again. And Gunu has, on behalf of all of us, some presents to give for the school. It is a first aid set, some medications.
Oh.
A stationery kit. We hope that in years to come, if you decide to come again here, we will have cooperation.
Can you shake hands again?
Shake hands? Shake hands? Manager, you hold that?
Yeah, that's good.
Everybody, shake hands.
That's great. Okay.
I'm really bad at
Very good.
Can we say something? Please. Thank you. On behalf of the school manager, Mr. Khan is here, and you might, maybe you have not seen this gentleman on my left. He is the founder of the school. Right, ladies and gentlemen, on behalf of the school, I take this time to express our most sincere gratitude to all of you in offering these medical services that we've never experienced in the past. And actually we were so grateful that the team right from overseas that come all the way to Seaqaqa. This is almost the interior of Vanua Levu. We are right in the middle of Vanua Levu. So we are so thankful because this is another way of the school reaching out to our community. You're probably thinking that you are reaching out to the community. We are also, taking it as our way of reaching out to our community. And we are so thankful for this service. And our prayer that God will continue to bless you, will lead you, and continue to give that heart that you have, expressed today, that you love the people of Seaqaqa and everybody in Fiji. And we also want to share our love to you. Thank you very much for being so kind and being with us. God bless you.